Okay, so I would perform hand hygiene, put on PPE if indicated. I gather all my supplies here already. I'm going to knock on the patient's room. Hi, my name is Wendy. I'm gonna be your nurse for today. Can you state your name and date of birth? Okay. So at this time, I would perform privacy. I would close the door or the curtain, and I would explain the procedure to the patient that I'm going to perform a physical assessment from head to toe. So first of all, I will start with the physical appearance. The patient facial features appear symmetrical. Um, does the patient have shortness of breath, pain, and then I will move on to the the body structure. Is the fat well distributed evenly? Is um, is the the weight appropriate to his age as well as his height? Is the patient well groomed? Um, his patient's behavior. Is he calm? Is he restless? Is he upset? Stuff like that. Then I will go ahead and assess his mobility, and by that I would ask the patient if they can stand up, and I would be observing his gait if it's stable, and then I would ask them if they can walk, and if they can walk on his heels and then heel to toe. Also, I would assess, or I would assess, yeah, I would assess for the Ronberg test, which is that, and his range of motion. Once I'm done with that, I would go ahead and obtain his BMI. And his BMI, basically I would get his weight in kilogram and his height in centimeters, and I would divide those to get his BMI. Then I'm gonna go ahead and assess for the pain. I'm going to ask if he has any pain. I'm going to ask if he has any pain in a scale of 0 to 10, 0 having no pain, 10 having the worst pain. Where does the pain, where is the pain located? Does the pain radiate to other body parts? Is the pain dull, sharp? Is it constant? Is it intermittent? Does it affect certain activities of the daily living? Does it hurt while doing certain activities? Stuff like that. So then once I'm done assessing for pain, I would go ahead and inspect his head. If he has a poor groom groom he I would put on or infestation supplies. I would put on my gloves, and I would be checking for hair distributions, and I would be palpating for mass and lesions that the patient might have. Um, Also, any scars. Um, then once I'm done assessing the head, I'm gonna go ahead and move to the eyes, and by doing that I would be assessing the eyelids, the eyelashes as well, the are the eyes symmetrical? Is the pupil symmetrical in size as well? Do they have any abnormalities? The conjunctiva and the sclera, all that. Also, I'll be checking or assessing for the peripheral vision, and see also if the patient is able to read, and that would complete cranial nerve number 2. Okay, so then once I'm done assessing, I'm gonna go ahead and check for the oculomotor of the eyes, which is cranial nerve number 3, and also cranial nerve number 4. By doing that, I'm gonna tell the patient that I'm gonna be turning off the light, and I have here my pen light, and I would tell the patient that I'm going to be assessing his eyes, and I would bring my pen light to the eyes, starting from the outer, and basically the pupil should constrict while I bring the light to the eyes. Also, what else? Okay, so I would now check for pupil accommodation, and by that I would basically I would tell the patient I would bring the pen light about 10 to 15 centimeters away from the bridge of the patient's nose, and I would be telling the patient that they need to follow the pen light. So first of all, I'm gonna start from the middle to the top, then to the bottom, to the right side, to the left side, diagonally, and the other way. Okay, so this is basically okay, so this basically when I'm done, I would be checking for the test convergence, and the test convergence basically would be testing. I would bring the pen light about 6 to 8 inches. 6 to 8 inches away from the patient, and I would tell the patient to stare at the pen light, and I would bring the pen light near the patient's nose, and basically the eye should crossed, and that would be cranial number 6. What else? Oh, I forgot the also where I put the pen light about 1 foot away from the patient nose, and I would ask the patient to look at a far object and then to a near object, and basically the pupil should dilate when they're looking at a further object and should constrict when they're looking at a near object. So that would complete the assessment of the eyes. Then I will go ahead and move to the ears. Basically, I would be inspecting or assessing that the ears are symmetrical in size, that they don't have any masses or lesions or abnormalities. Then I would go ahead and assess if they have any earwax or any foreign objects. So now I'm gonna go ahead and stand behind the patient about 1 to 2 feet away, and I would tell the patient to cover one ear to test for his hearing. So I would instruct the patient to repeat what I'm going to whisper, and then and then I would do the same thing with the other ear. They cover one ear and they are going to repeat what I whisper to them. What else? There's also the test, the Weber and the Rhine test. They also test for hearing loss. The Weber, it's an equipment that they put it on the patient's ear, and the Weber is basically on top of their head, in the middle of their head. I'm going to now go ahead and assess the nostrils. For that, I will put on my gloves, and I would instruct the patient if they can occlude one nostril, so that I can know if they can breathe through it, and then for them to cover the other nostril. And by doing that, also I would with my pen light, I would be checking for any masses or lesions that the patient could have inside their nose, if they have a septum deviation as well. Then I'm now going to test the olfactory nerve, which is the cranial nerve number 1. And basically what that constitutes is that I would ask the patient if they can close their eyes, and I would bring let's say I have a cotton ball here, so they should tell me what they smell, if it's like an alcohol or if it's coffee, and things like that. So now moving on, I'm going to inspect the face. By doing that, also I would tell the patient if they can close their eyes, and that would be I would be testing for the cranial nerves number 5 and 7, and I would tell them to close their eyes, and I would ask them where they feel the cotton ball, if it's in the forehead, on the chin, on the left cheek, on the left side, or on the right side. Once I'm done with that, I'm gonna go ahead and move to the mouth. I have a pen light. I would ask the patient if they can open their mouth, and I would be checking for any abnormalities, their oral mucosa, their teeth, their tongue, what else? Their tonsils, all that. So I would give the patient or I would put tongue depressor, and I would be checking for cranial number 9 and 10. Also, what else? Okay, so then, I will instruct the patient if they can, with their tongue, if they can pull their cheek, kind of like this. And for that, I'll be checking cranial number 11, cranial nerve number 11. Once I'm done with that, I'm gonna go ahead and I'm gonna go ahead and inspect their or check the cranial nerve number 12. Or first of all, I will go ahead and check their lymph nodes if they are not swollen. First of all, I would check only one side, and then the other one. And while I'm here, also, like, I can check for the jugular veins if they are distended, and for that I would put the patient at a 45-degree angle. To check for the spinal nerves, I would go ahead and check for cranial nerve number 11, and for that I would ask the patient if they can touch their chin to their chest, and then if they can turn around and touch their chin to their shoulder, to their left shoulder, and then to their right shoulder, and then if they can touch their ear with the shoulder. And that would and also I would put pressure on the shoulders, and they need to put resistance to it. So moving on, I'm gonna go ahead and check or assess the patient's posterior thoracic, and by doing that I would first so I forgot to check for the trachea. I would press not too hard on where the trachea is, a little bit to the side, to see if they don't have any masses or any lumps that can be filled, or any tenderness. So yeah. So then now I'm gonna go ahead and assess the patient's posterior thoracic. I would be checking that they don't have any lesions, that both sides are symmetrical when they're inhaling and exhaling. They don't have any masses or abnormalities. Also, we'll be checking the temperature. And once I'm done assessing and inspecting, I'm gonna go ahead and use my stethoscope. Okay, so and I would start listening for any abnormality sounds. I would go all the way to the 12 points in the back if they are abnormal, and if they are not, just a few. I would just do just a few. Once I'm done assessing the back, I'm gonna go ahead and come here to the front of the patient, and I would tell the patient that I'm going to be assessing the anterior thoracic, and I'm going to I'm going to go ahead and expose only the area, and I'm going to be listening with the diaphragm, and then later on with the belt of the stethoscope. First of all, I'm going to be checking for the aortic, and then the pulmonic, and then the Erb's point, and then tricuspid, and then the mitral. So then, and then once I'm done assessing that, I would be checking also for the lung sounds. So I'm gonna be listening to the heart sounds for any abnormalities. Oh, and something I completely forgot about was while I'm assessing over here in the back, I need to check for the expansion. I would put both my fingers on T9 and T10, and I'll be checking for the expansion while the patient is inhaling and exhaling. So, okay, once I'm already done assessing the lungs in the anterior thoracic. Also, I forgot to, or I can be checking for the skin turgor to see if the patient is well hydrated. And now I'm going to be assessing the arms, the upper extremities, and by doing that, I'm going to be telling the patient if they can put pressure while I'm putting resistant, and as well on the top. I will be assessing the brachial and the artery both at the same time, and I'll be checking for any masses, lesions, scars that the patient could have, on their the temperature as well, and I would ask the patient to if they can squeeze 2 of my fingers, and check for also for capillary refills on both hands, and note if they have any clubbings of the nails, the texture of the nail, if they don't have any presence of cyanosis that might be noticed. So yeah. So once I'm done assessing this, I'm gonna go ahead and move to the abdomen. I'm going to tell the patient that I'm going to put him in a supine position. So I'm going to bring the bed level to an appropriate comfortable position, and I'm going to assess if they don't have any masses or lesions or cuts, scars, and then once I'm done assessing, I'm going to auscultate for bowel sounds. So I'm going to first start from the right lower quadrant, and then upper right quadrant, left upper quadrant, and then left lower quadrant. Once I'm done assessing the bowel sounds should be heard within like 5 seconds to, I believe, 30. Then once I'm done listening to the bowel sounds, I'm going to palpate the abdomen. I'm not going to go beyond 1 inch and I'm going to start assessing first from the lower quadrant, lower right quadrant to the right upper quadrant, left upper quadrant, and left lower quadrant. And if the patient is experiencing any pain, I will do that quadrant at last. So now I'm gonna go ahead and assess the growing pulses, and then gonna go ahead and move to the lower extremities. I would be assessing for any abnormalities, masses, edema that the patient could have. For edema, I would check on the patient's lower leg, and also the pulses, the popliteal and the pedal pulses, doing both of them at the same time. And also you want to look at the hair distribution, and yeah, so once I'm done with that, I'm gonna go ahead and assess for capillary refill of the toes, also the nail structures, and so on and so forth. Also, I'm going to ask the patient if they can bring one leg up at the same time, and the other leg up, and basically this is to test how their legs, or how, like, how much they can bring their leg up. Once I'm done with that, I'm going to also assess the range of motion and of the lower extremities, and also the deep tendon reflexes, as well as the Babinski scale, or reflex, I'm sorry. Basically the Babinski reflex is usually infants, is positive for infants, and you kind of like slide something on the patient's plantar, and the big toe will go to the up front, and the other toes would kind of like fan out. So once I'm done assessing that, I'm going to tell the patient that I'm going to put him in a comfortable position. I'm going to place the cowbell within reach, and if they have any questions, I'm going to clean my my equipment, and also on the, while I'm doing the lower, assessing the lower extremities, I also wanna ask the patient if they can close their eyes while I kind of like poke him with something sharp, well, not that sharp, but kind of sharp, and they can tell me where they can feel it. So yeah, and then we're going back, well, I put the patient to a comfortable position, lower the bed, cowbell within reach, and I would perform hand hygiene. So that's it.